When you to make a memo, ache, Ediba, happy morning, Joseph. Good morning, sir.
Good morning.
Okay, how are we doing, sir?
We are doing well. Your side?
I'm good. Tell us, how's the Volta region now?
Yeah, Water region, as you know, the flood situation is what we are facing currently with the aftermath effect of it, which is affecting the people currently on the ground. And we are doing our best to see how we can to get the plights of the people.
I believe you're on the ground at the moment, aren't you?
Yeah, as a regional risk communication officer, I have my links with all the health promotion officers at the ground, and I pick information from them day and day.
Okay, so the information you're picking, the water levels that is taking people's homes and taking away their properties, is it rising or we are hoping to have it dried out?
Yeah, as we speak, it is still at the level it was as at yesterday, meaning it is stagnant for now. So it's not receding, it is not rising yet. But the fact of the matter is a whole lot of people are displaced.
We'll talk about the people displaced, but when this kind of water that we know carried away a lot of things that we cannot talk about, it remains stagnant. It calls for alarm, right?
Yes, please. It calls for a public health alarm.
And where are we as a people, in fact, the people of the Volta region, when this alarm is ringing loudly in the minds of people? What do you say is the potential risk that we are to face?
Thank you very much. As we speak, we anticipate the public health concerned diseases, or I will say the fecal oral diseases or water-related diseases. We anticipate them to be on the rise. But the fact of the matter now is Ghana Health Service is rendering free healthcare services to these people in order to attend to them. Because in the case of this issue, most people lost their valuables, even their health insurance, so they can't attend to healthcare. And as we speak, some people try to use the water for their domestic chores. Meanwhile, it is a whole lot of issue, because when we talk about this kind of water, we carry away dead animals that cannot escape, where people were buried, the cemetery, the mortuary, and people's latrine and others are all submerged in the water. You will realize that the water will be contaminated with, fecal matter and other diseases that will be in it. So there will be an alarm of cholera, diarrhea, typhoid fever, and then even the effect of it, the pressure, will also result into diseases like hypertension, which is a stress-related disease. So you realize that there's a whole lot of issues as associated with this flood as far as public health is concerned.
Right. We've not had any fatalities yet, but can you report of any of these communicable diseases being reported?
Yeah, to be frank, we don't record any other rise in the conditions yet, looking at our threshold as a region or as the affected area. But these diseases have incubation period. So in the time that the people are infected, to the time that they begin to show the signs and symptoms of it, it takes some number of days. Some take about 21 days, some take about 18 days and above. So we are anticipating that in time to come, we may record some of these diseases, but risk communication is going on, social mobilization is going on, so that people can provide these people with the potable water, and they will practice the maximum hygiene, or wash as we call it, so that we can prevent these diseases.
Before we get to the end of the incubation period, as you anticipate, Is there anything through the health ministry that ought to be done in order to forestall any outbreak of such diseases? Because I think that you have to be well positioned to be able to absorb the pressure that may come from it.
Yeah, as we speak, we can't say we have enough of the resources. We are still galvanizing the resources, both the health commodities and then the human resource that will render the service to these people. Bear in mind that some health officers, even on the ground, are also affected in the peripheral facilities, the chief zones, and then the health center, and even some staffs of the main hospital at North Tongue are also affected, which blows some kind of alarm. So we are trying our best, though GRNA, that is Nurses and Midwifery Association, is trying to mobilize some personnel to help. We still need more in order to curb this aftermath effect of the disease or the flood.
So you talk of personnel and logistics. What in it that you need?
Yeah, when we talk about the personnel, we know we have our risk communicator, we have health promotion officers, we have the nurses, we have the physician assistants who will render the clinical services and the preventive services to these people so that they will understand why they need to take certain actions in order to prevent the diseases I earlier talked about. However, we also need these medical commodities, such as the disposable, the consumables, and then the medications that when we begin to see the signs and symptoms and we begin to see people experiencing this kind of disease, we can quickly treat them so that they will not spread them.
I know that on the ground, before the spillage, people were a bit reluctant to leave the affected areas. Do you think that the sort of conversation you're having with the people is really making an impact?
Yeah, when you are somewhere and you have your comfort before you move to another place, is also a different thing altogether. But what is happening is people who lost their home and then they have nowhere to lay their head. The NADMO and then the VRA, they are doing their best to provide the safe havens for these people where they rest, even though it is not comfortable as their home. But there are more education going on so that the people can understand the reason why they need to leave those areas in order to be safe.
Given that we are now trying to position ourselves health-wise to avert any kind of outbreak, would you then say that our approach to the spillage and the consequences thereafter was a bit feet-dragging?
I may say so.
You believe that we didn't position ourselves well in terms of the health implications that may come out of the spillage?
Yeah, to me, I would say the health service is doing its best to provide the necessary health assistance that these people need.
But it has been reactionary.
Yes.
We didn't prepare in advance. That's what I'm trying to find out.
We do not anticipate that this will result into this much. But however, as the situation is now, we are trying to react towards it as much as we can.
All right, sir. Thank you very much for your time.
You're welcome.